I want to transition now to talking about alcohol's relationship with anxiety. I think a lot of people, um, from my understanding of it, is they're kind of very correlated. And one
Mhm.
person who has an AUD may experience anxiety and vice versa. So, can you talk about the relationship there between
Sure,
alcohol use and anxiety?
absolutely. So, alcohol use disorder and anxiety are present about 50% of the time in combination. So, 50% of people with alcohol use disorder will have anxiety and or depression. So, the reason anxiety is common in this group of drinkers is that there's several reasons. So, the most obvious is that alcohol withdrawal itself is anxiety producing. And so, sort of the mildest form of alcohol withdrawal is a hangover or a bad hangover. But when you get to a certain amount of drinking, it then can progress from just a bad hangover to shaking, heart racing, sweating, nausea, lots of unpleasant physical symptoms. However, you also have very unpleasant psychological and mood symptoms as well. So that during a hangover, during alcohol withdrawal, the anxiety goes way up. And the reason it does is alcohol is a depressant, and withdrawal from any substance, you can pick any of those drugs out there. Withdrawal has the opposite effect of what the substance has. So, alcohol is a depressant. It probably lowers your blood pressure and heart rate a bit. You feel calmer. So when your body's used to it, like, hey, got to get that every day. But when you don't get it, you have the opposite effect. So you get a lot of anxiety.
That's really interesting. I never thought of it like that. Wow.
Yeah. So that's the real cornerstone whenever you do a medical evaluation of someone with alcohol problems is to assess their alcohol withdrawal risk. The reason is more severe alcohol withdrawal can be life threatening. There's a thing called delirium tremens, which is unusual, but it's basically eventually your body can't maintain its blood pressure or heart rate properly. And that's what really kills people with delirium tremens. Um, Now, you hear the word alcohol withdrawal delirium a lot. Not all alcohol withdrawal produces delirium. There's a lot of alcohol withdrawal that are in an intermediate zone where it's mostly shaking, sweating, nausea, high blood pressure, anxiety, insomnia, um, and that a number of those folks will progress to either perhaps having alcohol withdrawal seizures or could progress to delirium tremens. And in general, it's on a time course. So 48 hours after your last drink, you're at risk for alcohol withdrawal seizures. 72 hours or more after your last drink, that's when the risk for delirium tremens comes in. And delirium tremens is basically what they call it an alteration in your sensorium. What that really means is you can begin to feel things, bugs crawling, see things, so visual hallucinations, and then also hear things, auditory hallucinations, and you get disoriented. And that's basically what delirium is in general. So maybe I sidetracked there a bit, but anxiety is very common in alcohol withdrawal for a lot of people. Now, what do you do when you have anxiety and alcohol withdrawal? Oh, that's easy. Hair of the dog. You have another drink, right? It's a great reason to drink. Hey, let's have Bloody Marys today. Hey, how about a mimosa? Yeah, it's time honored and it works. You can treat alcohol withdrawal with alcohol. And a lot of us do that. So, um, so anxiety in that respect is from alcohol withdrawal, and it's a huge trigger to drink more. Now, the other brand of anxiety, and I like to separate the two, although in real life they're all mixed together, is that a lot of people have an anxiety disorder independent of alcohol. So that could be generalized anxiety disorder, which is the most common, and it's kind of exactly what it sounds like: worrying, nervous, thinking too much is a big one. So obsessing about things, being on edge, all of those things. And that's kind of generalized anxiety. There are more serious anxiety disorders that need to be identified because they're treated differently. And so those include social anxiety disorder, obsessive compulsive disorder, or OCD. And then also PTSD, post traumatic stress disorder, causes a lot of anxiety and panic attacks and sleep problems and all other stuff, vigilance. So I'm not going to go into details about how do you diagnose social anxiety disorder, OCD, and PTSD. Oh, and I forgot panic disorder with agoraphobia. Agoraphobia meaning you're afraid to go outside, essentially, because you're afraid you're going to have a huge panic attack and maybe die or at least embarrass yourself in public. So when you have a medical assessment, it's useful if the practitioner can make some sort of assessment of whether you have a full anxiety disorder or not, independent of the alcohol. And it's not an easy call to make, but yeah, the alcohol use disorder and anxiety come together frequently.
So what medication approaches do you see useful if someone is experiencing anxiety and may or may not be linked to their drinking?
It's a very useful question, and I'm going to start with what you shouldn't do. And your provider should not give you a benzodiazepine. And benzodiazepines are Xanax, Ativan, Klonopin, Valium, Librium, etc. Those are the product names. Now, you may need those if you have severe alcohol withdrawal. The only exception is if you have very severe alcohol withdrawal, then benzodiazepines are the treatment of choice. But that's just to get you through a very difficult detox. You'd be on it for a matter of certainly a week or less, and then you'd be off of them. That's the only exception. But we really try to avoid benzodiazepines in people who are drinking. They're both depressants. They have an additive effect. It affects your coordination. It affects your walking and balance. It affects your thinking, and it definitely affects your behavior. Because what gets people in trouble with alcohol, their behavior, they're disinhibited. Right. That's why we drink, right? If you're gonna have two or three drinks and like chill out, um, it's the disinhibition. So on a mild level, that just means you stop worrying so much and your mood gets a little better. Um, we've all seen drunks at parties who are obnoxious, right? They're either obnoxious socially, they're threatening. Sometimes they're obnoxious in, being annoying because they're so happy and garrulous. So that's the disinhibition part of it. So just we avoid benzodiazepines in treating anxiety in people who use alcohol. So that's what you shouldn't do. However, there are multiple other medications that can be helpful for anxiety. In fact, naltrexone may have some mild anxiety reduction. It's pretty mild. It's hard to sort out if it's because you're drinking less that you're feeling better or not. And then the other alternative is gabapentin. Gabapentin is evidence-based. There's an evidence base for gabapentin in people cutting down on their drinking. Gabapentin reduces anxiety and it can treat alcohol withdrawal as an alternative to benzodiazepines. You can take, it 3 times a day for anxiety or craving, actually, or you can take more at night for sleep. It's generally very well tolerated and doesn't have drug interactions. Some people do get a little sleepy on it or tired, and if so, you just have to take less. Like if you take it during the day and you're like zonked and you have to go to work, obviously you need to take less or put it all at bedtime. But gabapentin is a great medicine for that situation. There are a few others. So SSRIs, so serotonergic antidepressants, and you probably heard all these names before: Prozac, Zoloft, Lexapro, Celexa, Paxil, and I don't want to forget Luvox. They work for anxiety. They came out as antidepressants, but as a psychiatrist, my opinion is they work better for anxiety than they do for depression, but they do take a number of weeks to kick in. So it's not like taking a Xanax and, oh, I feel so much better. You have to take it every day for usually several weeks to get the reduction in anxiety. Other medications that can be used are Buspar. or buspirone, that's spelled Buspirone. There's research that demonstrates that Buspar or buspirone works for anxiety in people who drink. The medicine's been around a long time. I've never been a big fan because I didn't think it did anything. But now that I'm reading more and starting to prescribe it, I do see it actually does help anxiety symptoms. Generalized anxiety in particular, it's not at all habit forming. Generally, people tolerate it. So Buspar or buspirone. So I mean, there's several options for medications. Oh, one more I should mention: mirtazapine, which is Remeron, Remeron. It's an interesting medication. It's given just at nighttime. It treats depression. It treats anxiety. It treats insomnia. And there's evidence that for people with social anxiety disorder and alcohol use disorder, that it works great. Now, big problem with mirtazapine, highly associated with increased appetite and weight gain. And that can be a no-go for a lot of people. But I did want to mention it that, there are multiple options for treating anxiety with medication in people who use alcohol. The data we have in reducing alcohol use is based upon numbers, and the number we have best access to are breathalyzers. So you, in real time, you give a breathalyzer, and via the digital interface, literally via Bluetooth, you download an app. The app's on your phone. You set up Bluetooth with your breathalyzer. You blow into the breathalyzer, and literally the data gets entered, and something that your coaches and your medical team can review in real time. And it's not meant as a way of checking up on you and getting you in trouble. It's really a way of keeping you accountable and giving some real data. And so you can better understand the patterns that you fall into when you're drinking.